What is the genetic test for celiac disease? Have you ever wondered how doctors determine if someone is at risk for celiac disease? The genetic test for celiac disease is a key tool in this process. This test looks for specific genes known as HLA-DQ2 and HLA-DQ8. These genes are closely linked to the likelihood of developing celiac disease. They play a role in how the immune system identifies foreign substances. Now, just because someone carries one or both of these genes does not mean they will definitely develop celiac disease. Many individuals with these genes never experience any symptoms. So, while a positive result indicates a higher risk, it does not confirm the disease itself. The genetic test is typically performed using a blood sample, saliva test, or cheek swab. This flexibility makes it easier for people to get tested. It is particularly beneficial for those who are already following a gluten-free diet. In such cases, antibody tests may not provide accurate results. This test is also useful for individuals who have unclear or ambiguous antibody test results or biopsy findings. Additionally, family members of those diagnosed with celiac disease may want to get tested to understand their own risk. If someone receives a negative result from the genetic test, it effectively rules out the possibility of developing celiac disease later on. This can save them from unnecessary further testing. On the other hand, a positive result suggests that the individual should have regular follow-up tests, especially if they start experiencing symptoms. For those with sensitive stomachs, irritable bowel syndrome, or colitis, genetic testing can clarify whether their symptoms are related to celiac disease or other digestive disorders. Since symptoms can overlap, knowing the genetic risk can help guide further testing and management. However, it is essential to note that genetic testing alone cannot diagnose celiac disease. A complete diagnosis usually requires antibody blood tests and often an intestinal biopsy, while the person is still consuming gluten. In summary, the genetic test for celiac disease helps assess risk based on the presence of HLA-DQ2 and HLA-DQ8 genes. It is particularly valuable for ruling out celiac disease or identifying individuals who need closer monitoring, especially in families with a history of the condition. For those with sensitive digestive issues, this test can help clarify if gluten-related immune responses might be a factor, but it is just one part of a broader diagnostic process.